hello everyone out on the interwebs. Super excited for our digital health on air episode today. So, quick reminder: I'm one of the founders and the CEO here at Luma, and I am joined by one of my favorite people in all of healthcare. And I'm not just saying that to say that because we've known each other a long time now. But Marlena Kane is the queen of all things access and has had an incredibly impactful career in terms of delivering and modernizing access across a variety of different healthcare organizations. But she is our guest today on Digital Health on Air. And we're going to be diving deep into access and specifically the people and teams that really make access a reality at City of Hope, where Marlena is today, but across her career at the various types of healthcare delivery organizations that she's been a part of. So welcome, Marlena.
Thank you. Thanks for having me.
Of course. So quick resume and bona fides for Marlena. So today she is the leader of all patient access at City of Hope. But prior to that, so she leads, of course, for a very a leading regional health system with a growing cancer treatment footprint, I should say. But she's seen academic medical centers like University of Southern California, Keck, Stanford Medicine as well, and then a very large integrated delivery network at Fairview, and your staff was like thousands of people. I just remember it was quite the world there. So thank you for joining us. And for those who don't know you, I think it'd be great if you were to quickly share your background and how you came to City of Hope. And I know you're a very trusted voice in all things patient access, but some color there I think for audience will be super helpful.
Awesome. Yeah, I'm happy to. I know it's interesting when you announce me as a access leader. Like that's something that when I talk about my resume and background, I never really planned on that, right? These things happen organically. Never would I have thought that I would be, but I think this is the third time I'm leading access for a different health system, but we can talk about what got me there. I've been in healthcare my whole career. I love solving complex problems to make things better for patients. It's my why, and also developing people along the way to be able to do it even better than before. So I don't know if there's other things you want me to touch on, but I am at City of Hope now. We're solving for some pretty complex, specialized care and access opportunities here in Southern California. We've made a lot of progress in the last year. I just recently assumed responsibility for our established or return patient access team too.
Awesome. So our theme today is going to be around the most important skills for access leaders, and so let's dive into it. Over the years, you've really transformed Patient Access City of Hope, and of course the other organizations that we mentioned. And I want to get into what you've covered as the most important skill or focus area that really drives your work.
Yeah, I think this is such a good question, and a lot of people, in my experience, when leaders are asked to take on access, it's usually very late, right? It's when things have not been working for quite some time. There's a lot of frustration. And a lot of times it's organizations that see access as a more transactional department, as opposed to really a strategic front door to the organization and an opportunity to build talent that'll, stay for a long time and buy into what you're trying to do. So for me, when you learn operations, right? You make a lot of mistakes. You have a lot of learnings. You have some wins. You tend to come in as a leader and focus on let's, fix process and technology first. What I've learned is that doesn't work. You really have to make sure that you're putting all of your, most of your time and energy and investments in the people, particularly with access centers. I mean, I think you would hear a lot of leaders say that, invest in the people. Particularly in my experience with access centers, this is a team. Every time I've joined an organization that has had very high attrition, high, leave of absence rate, high call out rate, just high shrinkage overall. And so really digging into that, especially in Southern California, this is a team that wants flexibility, that often, cares for their family, their own family, children, potentially their parents or others, their caregivers, they have extended families that they're responsible for. Being able to move to a remote workforce has helped a lot. That's one. Number two, the work that you're doing in access is super transformational. You're uncovering 50 million layers of complex, long-standing things that one doctor decided 10 years ago that you're trying to standardize across 100 doctors potentially. So really getting the people and the leaders on board with what you're trying to do and having them help shape it is going to go much further. So you're going to go a little slower in the beginning to go fast later, as my sensei from Stanford taught me, Chris Fox. That's, and a lot of in companies, I've learned a lot of executives aren't always understanding of that. So you have to find the right balance, spending a lot of time with the people and making sure that in parallel you're investing in the right aspects of operations and the infrastructure. That was bad. I could say a lot more.
No, like we're gonna go there. We're gonna go deeper, but I think you're right. Like a lot of leaders in healthcare will say it's all about the people, and then it's kind of the slide title. There's not a whole lot of bullets left on the slide, and I think what I found your approach is one very purposeful and thoughtful, and then there's real impact to it, and it's thought through. And a lot of folks in your seat, in the access seat, often will want to talk about like, hey, what's the cool new technology that can help me automate workflows, that can do this, that can do Y, that can do X, right? But you started with people on purpose. You often talk to me about like rounding and how impactful that is. Like let's go deeper there in terms of like really what you uncover there, how that's changed your perspective and approach with really prioritizing people before process of technology.
Yeah, and I think the reality is that like I'm saying prioritize people, and it's probably like I look more tired today than when I started last March because we have so many different, I have tons of bosses and tons of customers, right? So I'm spending a lot of time with building trust and relationships with the people, but at the same time, I'm making sure that in parallel, I'm partnering to show that we're demonstrating improvement on our KPIs, that we have the right technology to be able to let us, grow and thrive. So there's a lot of different parallel paths happening.
Yep.
I have the opportunity to learn lean management with James Hereford, who I know you know well. I was super lucky at Stanford to work closely with him, and then lean sensei. So my kind of how I think about and do work and lead teams is via lean management. So a big part of lean management is obviously looking at process and reducing things that are not valuable to the customer. But the more important part to me, and the part that really has always resonated, and I learned from James and others, is that you're developing your people at the same time so that they can be bought in, they can solve their own problems, and they can scale, translate that to their staff, who are the experts. And there you have a situation when you're investing a lot of time up front. Now you've developed not only a team of leaders, but you've developed them to empower their teams to solve problems. And then you have 200 problem solvers, instead of 5 of us trying to firefight all day. So that's the foundation. The other thing about it is I'm really visible and present. When I first started here, I would ask my team, can I go round? They thought I was crazy. They were like, we didn't prep for this. It might be dirty. I was like, I want to go. People wouldn't even give me eye contact at that time. Now I have my set rounds every time I'm here. I walk in there and they're giving me crap for, now I have my new team and they think I'm paying more attention to them. But I set the standard for supervisors, leads and up on the team to do at least an hour a day of Gemba rounds. When we compare our KPI impact to before we started doing that to now, where we have huddles, rounding, metrics review, it's a pretty incredible improvement. And the team is super engaged. So yes, I gave them 4 days of working from home since I started. That helps. But they're involved in the process improvement. They know how we're doing on our metrics. They can speak to why a lot of the time. They're calling me over for ideas. That is the missing link, I think, in a lot of places. And I wasn't able to do that as much at Keck. If I'm looking back, I think starting out, I got my offer at Keck a week before we shut down for COVID in LA. It was different. I think we've learned how to interact virtually better. And I was coming in 2 days a week here with the team, at least when they were here. So I will summarize that point by saying you invest in the people, but it's not just in terms of getting to know them and relationships. It's a lot of that. It's, hey, look, I don't want to just be known for being the most differentiated access center, for oncology care. I want to also be known. I want us to be known for the access center where people like develop, grow their careers, where we have, very low attrition. It's been, I think, about 6 months in a row, we've had 0% regrettable turnover in the department.
Wow.
When I started, we were at closer to 30% shrinkage. So let's stay and grow with us. I've promoted, I think, about 11 to 15, maybe close to 20 team members across the teams. I think more than that. We're, responding to their feedback. This is a team and a staff and department that tends to have higher turnover. I don't want that. I want to keep the talent, because that's the part that you can't put into the tools and the technology, the relationships, the understanding, the nuances. So that was a long way of saying that I do spend a lot of time being intentional about how we interact with our teams, and I've set expectations with my team to do it too, and they're doing it every day. Now,
this is awesome, and I think like for folks tuning in, like something that we all know and sounds simple, right? Which is like start with your people, prioritize your people, be purposeful, intentional, like prioritize it. I mean, you've lived it, and then the ROI is clear, right? Both in terms of the business KPIs, in terms of like it being night and day from before you implemented this to where you are now, and then also on the people side, like the retention improvement that you've shared. We know, we speak to access leaders all across the country. It's one of the biggest things they struggle with is recruitment and retention. And here you move the needle beyond recruitment and retention. You're talking about career growth, progression, and up-leveling, which is awesome.
And the team, this is a really talented team. I mean, the way I won't, they've gone through a lot of change. I think like a lot of access centers, and this is something that's unique. There tends to be a lot of turnover in access center leadership. It's a hard job. We all have hard jobs. Access in particular is the front door. It's very tightly connected to how our physicians get reimbursed and how they advance their research in an academic setting. It tends to be a department that is most ignored, least invested in, but we get the most, feedback and complaints. So I think it is. And I would venture to say that if you were to ask all the executives that I work with, if I were moving fast enough on impact, I mean, our KPIs do speak for themselves. I think being transparent, there would be some that think that maybe I spent too much time up front with the team, or that I'm doing too much coaching. But again, in my experience, not only does that help them thrive more, they're happier. And frankly, that's my why. That's what fills my cup too. So yeah, we can let them, I know that it will always, work out. And I just need to make sure I continue to prioritize that for them, because they're our future healthcare executives.
Absolutely. No, absolutely. Okay, this is super helpful. Like, talented team, obviously a phenomenal leader with you at the helm. Hard ROI. In terms of spending time with the team, you touched upon this. Like some really great ideas came out of that. Like, is there like an operational improvement or something that like you guys put into place that like came out of one of those interactions that you're really proud of?
Oh yeah, there's a lot. It's interesting now. Like they like to bring me proposals, and they like have their A3 with their problem statement, and I'm like, well, how am I supposed to, say no to this? But okay, we have, like a lot of access centers, one of the things that we struggle with are scheduling errors, right? So we went from pretty quickly a couple of like decentralized, couple physicians had their scheduler. They knew their name. Marlena was their scheduler. They sat right outside their door. This was a few years ago. So transitioning to a centralized team when I started was a generalist, a team of generalists. They scheduled for everyone. Well, we've since moved to getting into specialized teams, but it takes time to learn all of that again. And there's only so much you can put into Epic decision trees, right? Which, by the way, are beautiful when they work and when they're updated. We have struggled with scheduling errors, and we couldn't figure out how to get them down, right? We did trainings, we invested, we did coaching. And then I thought, well, what do I do when when I'm really working through a problem is I lean into my lean management system. So I asked my leaders to start tracking it every day. Track your scheduling errors each day and bring it to my huddle. And I brought it to my leaders' huddle. So reported scheduling errors. And not only, they started reporting them, not only did we do that, but I asked them to start reviewing them in their team huddle and they weren't sharing these with their leads and their staff, right? So they started asking their team members, our frontline teams, for input. We started at almost a 4% error rate when we started tracking in February, and we're down to just around 1%. But our scheduled appointment volume's gone up quite a bit over those months. So this is ideas from them in huddles, taking information back. They have, even though we have Epic, if you walk around and I round with them, they still have their documents. So I'm like, how do you put that, in the tool? But how do we keep a certain amount of the critical thinking and the, empowering them to make the decisions as well? So that's one. We're really proud of that. They've given a lot of input. Actually, I have a department meeting tomorrow, and they're I guess planning to bring to me a competition that we're going to have department to get it even lower. I guess I'm going to have to buy them something like, food of some sort, I bet. So that's one, Adnan, because that one gives them pride because they don't like making errors, number one. Number two, it obviously doesn't hit the patients or the physicians taking a new patient slot. That's so precious. Number three, it shows me and demonstrates to me that we're advancing our culture of comfort with transparency and making problems visible and not having shame in that and collaborating on results. That did not exist. This has been a big, I don't know, I guess, transition for us that I'm very proud of.
I love it. That's real impact coming from the team and the people themselves. And now cool to see that they're like kind of like up level it by gamifying it. I love that. Tacos are our food of choice here at Luma, so I totally get it.
We have better tacos than LA, but well, maybe I think for sure. They're very proud of it, but we bring the data to our physicians. Of course, we have to caveat it that it's self-reported, it's not scientific and everything. But our physicians are starting to use that language with us too on scheduling errors. So
that's super cool. Yeah, no, like getting providers to buy in is hard in any organization, and when they're start speaking your language, that's awesome.
Yeah,
I want to switch to gears slightly, but I think it's super related. I've heard you comment upon how important delivering a stellar patient or consumer experience is. Talk to me about the work that you do as an access leader, that your people and teams do, that, the culture you've set. Like, how does that really drive a differentiated and just a stellar patient experience to what you're trying to achieve at City of Hope?
That's a good question. And I would have to attribute a lot of what kind of how I think about this goes back to our Stanford days with Amir Dan Rubin and, the patient experience team and things that we also then with, James embedded lean with Amir. Healthcare, obviously, we all know this, is so complex, right? James talks about this too. It's the most complex industry out there. I mean, it's saving, not only is it life or death, but it's depending on, people to remember a lot of complex things to do that under high stress environments. And then we have to, use very complex, I want to say machinery, but whatever it is, equipment as well. And then we're regulated heavily with everything else. And I think that it's hard to fix process quickly. And when I've tried to fix process quickly in the past, I've burned out. I feel like I've burned, teams out. So that, I've learned a lot of things. I think the way that I lead today, if my first department that I led, talk to my team now, they would have a lot to talk about, I think. But I've learned many, many good things from my teams and just through the experience. But you can't fix process quickly. And if you try to, you either burn people out pretty bad and you don't have the resilience that you need to work in our environments, or you're just scratching the surface. So, but one of the things that I anchor into no matter what, because I'm passionate about it and because I know it makes a difference, is the, patient experience component of how we can go above and beyond for that patient. I can't change the fact that Marlena Kane's time to scene is 44 days. I can maybe, and, I have certain levers, but I really can't change the capacity constraints or other things. But I can certainly go out of my way to show empathy, to have a smile through the phone, to what we call at City of Hope, own the experience of that. And I'm annoying about it. I'm obsessive about it. Every time I round, I ask this, teams how they've owned the experience. I ask my teams to do it in every huddle. It's a little awkward in the beginning to say, Adnan, how have you owned the experience today? But it's getting less awkward. And the way that I talk about it is, we have complex issues to fix: templates, protocols, decision trees, access, capacity. But this is something we can do and we have control of. And every single day, it's our responsibility to show up to work to do that. That's my expectation. Sometimes we have bad days. Everyone does, but that's what I want. And in order to know and monitor that, we started tracking a post-call survey response, a positive response rate. In October, when we started, we were at 65%. In May, we hit 90%. We're at 92% so far in June. So just the constant, we can do that. We're in healthcare. We are dealing with patients that are in the most vulnerable parts of their lives. Take a little longer, slow down if you need to, go above and beyond. And you should see the comments that our patients leave for our teams. And I look at that. I don't print it out. I was going to say I print it out. That was going to age myself. I have it on my phone every time I round, and I go and talk to the staff and I read off what the patients say. I reinforce it every chance I get, and I expect my teams to do that too. And I do it, I mean, it's with each other also. So that has to be at the core. If you're waiting to fix process to see results, if you're waiting to get the perfect technology or the fanciest, it's in my experience, it will not work. And you won't be able to demonstrate the longevity of the impact that you need to truly get the investment you want from the organization.
Awesome. Well, normally I ask for any closing thoughts, but I think you've nailed it here. Talking about in line with owning the experience. You have owned this episode, Marlena. Marlena and I have known each other like for 10 years, and I'm always blown away that every time we catch up, and even today, like there's some new hot gem and some nugget that I leave with. So thank you for sharing your time with us. I know there's a lot of patient access leaders of today and patient access leaders of tomorrow in the audience. And so very, very practical, tactical, but also like really how do you think about orienting your career and your strategy to deliver very purposeful impact at a person level, at a team level, and then really you talked about the hard ROI in so many different ways. That's, you got to measure it, right? I mean, 30% to 92%, that is super real. The KPI improvements you mentioned, like very, very real. And for all the different bosses that you have, I'm sure that shines through in all the different interactions you have with them.
It takes a little bit longer, and it's an incredibly humbling experience. I mean, like I said, never did I know I would be where I am today. I kind of pinched myself, and I feel really grateful that all of these people trust me and align around what we're trying to do. But we're serving hundreds more patients in our communities because of the work and the work that our teams are doing. So happy to connect more if it's helpful. I feel like we need to do more of this because I learned a lot of the I don't want to say the hard way, but it would be nice if we could have more opportunities to learn from each other and connect. And Adnan and Aditya are some of my favorite, people that I would always say yes to connect with and recommend to work with. Just really, really good people and understand the problems and help guide us to solving the most important ones, not all of them at once, which sounds very simple, but a lot of companies that I've met with don't take that approach. So I don't take that for granted at all. Yeah.
Thank you. As always, you're the best. This was awesome.
Oh, I got
Thank you so much. You got a heart.
Okay. Thanks everyone for
I'll see you
listening. Thank you so much.